of the muscles that are attached to the outside will be known as the extraocular muscles, as opposed to the muscles that are present within the eyeball itself. So immediately now I will be talking about the muscles of the orbit that are present outside, in other words known as extraocular muscles. I know this is a little heavy slide, but I will go through it bit by bit, step by step, and inshallah we will go through all of these things. Keep in mind our targets for reading these things are: where does the muscle originate and insert, what is its function, and how does it affect the movement of eye across three axes. We will be discussing the movement of eyeball in the transverse, vertical, and anteroposterior axis. I will explain to them shortly, but first I would like to discuss the origin and insertion of the muscles. You can see from the orbit, this is the medial wall of the orbit, and these are the lateral wall of the orbit. So orbital cavity, it's like a cone that is diverging a little. The base of the cone is going front and laterally. You can see if there is a middle axis, it will be going like this. So the cone is going front and laterally. So that will be the direction of the whole of the muscles. It will not be the front exactly, it will be going front and lateral. If we look to the back, if we look to the apex of this pyramid, first roll me back a little. There are 6 muscles that are going to be attached to the eyeball. 4 muscles on 4 aspects: the superior, the inferior, the medial, the lateral. These muscles will be known as recti: superior rectus, inferior rectus, medial rectus, lateral rectus. 2 muscles are attached to the superior and inferior surface, but they are approaching it from a different angle than the rest of the muscle, an oblique angle, so they will be known as superior oblique and inferior oblique. Let's look at the recti first. All of the recti muscles, the superior, middle, and inferior recti muscle, they are originating from the apex of our pyramid in a ring. Here is the superior rectus, inferior rectus, lateral rectus, and medial rectus. This whole ring, it's called the tendinous ring of Zen. This is the tendinous ring of Zen. Let's look at the attachment of these muscles. The superior rectus muscle, it originates from the superior aspect of the tendinous ring, and it goes anterolaterally and it gets attached to the anterior half of the eyeball. It gets attached to the anterior half of the eyeball, anterior to the equator. All of these 4 recti are going to be inserted to the anterior part of the eyeball, anterior to the mid of the eyeball. So this is superior rectus attached to the superior surface. This is the lateral rectus going laterally, attached to the lateral surface, anterior to the half. Here the the 2 muscles are seen here. The superior muscles is levator palpebrae superioris. I will get to it shortly. Just beneath it, this muscle going, it's attached to the superior surface in the anterior half. That will be superior rectus. And then we are left with inferior rectus that has a similar attachment. Please note that these muscles are approaching eyeball from medial aspect. They are not approaching eyeball from just back. They are coming from the posteromedial aspect and attaching them. That thing will be important when we talk about the movements. Then there are 2 oblique muscles. Both of the oblique muscles have origin outside the tendinous ring of Zen. The superior oblique has an origin just supramedial to this tendinous ring. It goes along the roof, along the junction of the roof and the medial wall. It goes all the way there, and on the medial most aspect of the roof, on the anterior margin, there is a pulley known as trochlea. From the trochlea, it comes back and attached to the superior surface on the back aspect of the eyeball. This is known as superior oblique muscle. As you can see, as opposed to all rest of the muscles, it is coming from the anteromedial aspect. All of the other muscles were coming from posteromedial aspect. So it has a different approach. The inferior oblique muscle will be parallel to the superior oblique muscle. It is more better seen here. The superior oblique is shown from the lateral aspect coming here. The inferior oblique, it is originating from the floor of the orbit and is going to be inserted on the back of the eyeball. These two muscles are parallel to one another and both are approaching the eyeball from anteromedial aspect. Then we are left with levator palpebrae superioris. It has origin just above the tendinous ring of Sen and it gets inserted on the upper eyelid. Okay, let's talk about the axis of movements. The eyeball, let me make a few adjustments here. The eyeball, it is capable of moving in three axes. I have a globe here taken from my son's table. The eyeball can be moved across the vertical axis, the vertical axis will move from the top to bottom. If here is the pupil, the eyeball can move laterally, it can move medially. So I will be talking about right eye as a reference. So when we are talking about this along the vertical axis, the eye can look laterally, that is known as abduction, and the eye can look medially, that is known as adduction. The second axis will be the transverse axis. This is the transverse axis going from side to side, and along this axis the eye can look up, elevation, or the eye can look down, depression. And then we are left with anteroposterior axis. It is not very nicely visible in our eyes because our pupils and iris are uniform and they do not have any tattoos on them. So this is the axis that move from anteroposterior direction, that is the anteroposterior axis, and the eyeball move along it in this direction, that is known as intorsion, and it can move in this direction. I'm talking about the right eye, that will be known as extorsion. So these are the three sets of movements that can be present here. In the vertical axis there can be adduction and abduction. In the horizontal axis there can be elevation and depression, and along the anteroposterior axis there can be intorsion and extorsion. Let's talk about the functions of the muscles along the three axes, all of them. Let's talk about superior oblique. Let's talk about superior rectus first. Superior rectus is attached to the and I'm talking again, talking about the superior surface. The superior rectus, it's attaching the superior surface. This is the right eye and it is approaching from the medial aspect. When it is contract, it will move the eyeball up. It will help in elevation. It will help you to look up. Now the thing about the medial approach becomes important. When you look at the vertical axis, superior rectus is attached to the superior surface and it is coming from the medial aspect. We are talking about the right eye. When it contracts, it moves the eyeball medially. It is helping you to look medially. It is helping you with adduction. The third one, we are left with intorsion or extorsion along vertical anteroposterior axis. So it was attached to the superior surface. It was approaching from the medial aspect. When it contracts, it will help in intorsion. So these are the movements by the superior rectus. It is helping, superior rectus is helping in elevation. superior rectus in helping in medial rotation, or it is helping in adduction, and anteroposteriorly it is helping in intorsion. Talking about the right eye, of course it will be same with the left eye, but visually I am talking about the right eye. All of the things opposites will be true for the inferior rectus. Inferior rectus is attached to the anterior half of the lower surface, approaching from the medial aspect. When it contract the right eye, talking about right eye, it will lead to downward looking of the eye. This is depression. When talking about the vertical axis, the inferior rectus will help you look. Can you guess it before I do it? Medially. It helps you look towards the medial aspect. It helps you look to do adduction. And we are left with the anteroposterior axis. Let me get my muscle insertion fresh here. And we are left with the anteroposterior axis. Okay, here. The anteroposterior axis, the inferior rectus is attached. If we do like this, okay, this is the anteroposterior axis. This is the inferior rectus attached right here, and this is its medial approach. We're talking about the right eye. So when it contracts, it will move the upper surface of the eyeball laterally and and lower surface of the eyeball medially. That is known as extorsion. So you can see it right here. So these are the functions of the inferior rectus. Along transverse axis, it was doing depression. Along vertical axis, it was helping in medial rotation or adduction. Along anteroposterior axis, it was helping to move the eyeball extorsion, the upper surface laterally, the lower surface medially. We have done superior rectus, inferior rectus. Let's talk about the medial and lateral rectus. They are very simple. The medial rectus is attached here on the midline. It is just going backwards. It is only working to do medial movement of the eyeball, that is adduction. There will be no component for the superior and inferior, and there will be no component for the intorsion extorsion. And the same will be true for the lateral rectus. This globe is representing the right eye. The lateral rectus coming from here, it will move the eyeball laterally. It will help in abduction. Okay, now there is superior oblique and inferior oblique. Before showing them here, let me talk about the muscle. The superior oblique, it is, if we talk about the right eye, the superior oblique, it's coming from the apex of the pyramid, but before it inserts, it turns around the pulley, and come back to the orbit right here. So this will be the direction of pull of muscle in front of it. This will be the direction of pull of muscle. It will be different. So let us look along the transverse axis. I'm not talking about whole of the muscle. I will be talking about this pull of muscle. My hand is anterior to the globe now. My hand is medial to the globe now. This is the right eye. Superior oblique, when it contracts, it will pull the continent of Australia inferiorly. So it is doing depression of the eye. When talking about the vertical axis, let's get Africa in front of you. The muscle direction is like this, coming from anteromedial aspect. When it contracts, it moves the front of the eyeball laterally. So it is abducting the eyeball. And what we are left with? We are left with anteroposterior axis about the intorsion and extorsion. And this is the approach of the superior oblique from the anteromedial aspect. When it pulls like this, the upper surface of the eyeball moves medially, that is the intorsion. And in the end, we are left with inferior oblique. You may have guessed most of this by now. The inferior oblique will have all of the opposite effects. Again, it is approaching from the anteromedial aspect, from the inferior surface like this. This is anterior to the globe, my hand, the direction of pull. When it contracts, it will move the eye pupils, move the eye superiorly. It helps in elevation along the vertical axis here. If you see like this, it will move the eye laterally, and then we are left with anteroposterior axis. I will have to do it like this. It is attached to the back, pulling from the anteromedial aspect. When it pulls, it does extorsion. The upper surface is going laterally and the lower surface is going medially. So this is all about the movements of the muscles producing the movements of the eyeball. I will go to the clinical testing just in a while. So to summarize, these are the tables that you can see. These are present in your book. This is from the Snell's anatomy. Let me remove myself. This is the picture from the Snell's anatomy, and this is the picture from Gray's Atlas, Gray's anatomy, and this the Gray's it is very practical in the sense of talking in the axes. So you don't have to remember exactly the origin and insertions. About the origin and insertion, the point you have to remember is that four recti are coming from the ring. Superior oblique is coming above the ring, but it turns around the pulley. And the inferior rectus, inferior oblique is coming from the floor of the orbit on the medial aspect, anteromedial aspect. About the insertion, all four recti are inserted anterior to the mid half, anterior to the equator, on the surface as demarcated by their name. Superior rectus will attach to the upper surface anterior to the equator, and so on and so forth for the medial, for the lateral, so the inferior. And both of the obliques are attached on the posterior half of the eyeball, posterior to the equator, on the surfaces indicated by their name. Superior oblique will be attached on the back of the equator, on the upper surface, on the superior surface of the eyeball. The movements we have discussed along the axis, I will not be dragging this much longer. You can pause the video here, you can go back and try out for yourself, work it out how these muscles work. But to summarize, I want to summarize from this slide again. I would like to summarize by the movements now. The superior movement, the elevation of the eyeball. The elevation of the eyeball was done both by the superior rectus and the inferior oblique. And the depression similarly was done both by the inferior rectus and superior oblique. But you can see that this was the elevation and depression. Let's talk about adduction and abduction. It is very simple. The medial rectus does the adduction, the lateral rectus does the abduction. However, both of the recti, superior rectus and inferior rectus, were approaching from the posterior medial aspect. They were both responsible for moving the anterior surface medially, that was adduction. Superior rectus and inferior rectus were both involved with adduction. However, both the obliques, the superior and inferior, were approaching from the anteromedial aspect, attaching to the posterior surface, and they were responsible for abduction. When talking about the elevation and depression, the elevation was done by superior rectus and inferior oblique. One of them, the rectus, was responsible for adduction, and the oblique was responsible for abduction. So they cancel the lateral and medial movements, and when working together, they help the eye to remain in the midline and look up without deviating for the abduction and the adduction. So this is about the elevation depression, and then we are left with the intorsion and extorsion, both of the muscles that are attached to the superior surface, superior oblique and superior rectus, they are doing the intorsion, and both of the muscle attached to the inferior surface, inferior rectus and inferior oblique are doing the extorsion. So this is an interesting thing to remember, interesting way to remember it when talking about adduction and abduction. Both we will discuss the recti. Both the recti will adduct, both the obliques will abduct. And when talking about intorsion and extorsion, both the superiors will intort and both the inferiors will extort. So this is all about the eye. This is all about the muscles and the axis and the movements, and we are left with the nerve supply. And there is a very interesting mnemonic. You may have all know it by now. Before I tell you, LR6SO4. LR6SO4. So lateral rectus is supplied by cranial nerve number 6 and superior oblique is applied by the cranial nerve number 4. And both of these nerves are named for these muscles. Lateral rectus abduct the eye and cranial nerve number 6 is named as abduction. And superior oblique passes through the trochlea before changes in direction, and on that honor the name of this muscle is nerve is named as trochlear nerve. And we are left with all the rest of the muscles. Those are supplied by cranial nerve number 3. The rest are supplied by oculomotor nerve. It has superior division and inferior division. We will look at it shortly. So all of the rest are supplied by this. And then last but not the least, we come to the clinical testing. Here, one thing we want to discuss again, I'm going back to the globe. I hope so. It is not too much distracting for you. Let me get my background back.